Welcome to Social Security, Medicare, and your retirement. This seminar is geared to help you understand how the Social Security and Medicare programs work, discuss the important issues both programs are facing, and outline some effective strategies for supplementing these two important retirement benefits. Let's start with a quick question to get an idea of your perception of Social Security and Medicare. How many of you are worried that Social Security and Medicare benefits will be reduced or even eliminated by the time you retire? If you've raised your hand, know that you're not alone. Both programs have been in the news, and most of that news has been unfavorable. Reports of potential insolvency, tax hikes, private accounts, and increased eligibility ages have generated controversy and confusion. This Worksite Financial Solutions seminar is offered through your employer and your retirement plan advisor. Worksite Financial Solutions is a guidance-based, beginning-to-end retirement solution designed to help you create confidence in your financial life. The Worksite Suite offerings includes workplace education that's tailored to your unique needs and profile. It's also supported by a qualified LPL financial advisor who's committed to providing you with unified, coordinated advice. Whether you're joining the plan for the first time, accumulating assets, or seeking help with a career transition, Worksite Financial Solutions pulls all aspects of your finances into a single, manageable focus that will help you save time. We'll begin today's seminar with a quick look at the changing faces of retirement. From there, we'll review the structure of both Social Security and Medicare, how these programs work, the issues they currently face, and proposals for improvement. We'll review other important options, such as Medigap insurance and Medicare HMOs. Finally, we'll review some effective strategies for meeting your financial and medical needs during retirement without having to rely solely on Social Security and Medicare. For many older Americans, the final years are not always as golden as they'd imagined. Limited incomes and rapidly rising healthcare costs can potentially put a damper on dreams of leisure and comfort. Therefore, planning for your retirement is more important than ever. We cannot rely solely on Social Security and Medicare to provide us with the financial and medical means necessary to live comfortably throughout retirement. It's a safe bet that retirement in the future will cost more, significantly more, than it does today. Let's face it, costs for everything from healthcare to college to housing are rising. On a positive note, people are living longer, healthier lives. Consider these facts when planning for retirement. Fortunately, there is help available for supplementing limited incomes and covering medical care in your later years, but you need to take some initiative to find it. It also helps if you have the foresight to do some early planning. The areas you should be most concerned with are Social Security, Medicare, and retirement planning. Let's start with Social Security, the biggest and most controversial government program for retirees. Social Security is the general term that describes a number of related programs: retirement, disability, and dependent and survivor benefits. These programs provide limited financial assistance to workers and their families when their normal flow of income shrinks because of retirement, disability, or death. According to the Social Security Administration, about 61.9 million Americans received Social Security benefits in 2012. This group includes elderly retirees and their families, disabled workers and their families, and survivors of deceased workers. Contrary to what you might think, Social Security was not designed to meet all the financial needs that arise from a person's old age, disability, or death. It was, and is, intended to serve as a supplement to private savings and privately funded retirement plans. Social Security accounted for 37% of the income of all people 65 and older, according to the Social Security Administration. Social Security is funded through mandatory contributions by us and by our employers. Employee contributions are recorded in the Social Security taxes box on pay stubs. The taxes are held by special trust funds established exclusively to pay Social Security and Medicare benefits and administrative expenses. Trust fund assets not needed to meet current costs are invested in special issue U.S. government securities. You may begin to receive retirement benefits as early as age 62. However, if you choose to take benefits earlier than your full retirement age, you'll have to take reduced benefits for the duration of your retirement. So what is your normal retirement age? Workers born in 1937 and earlier can receive full benefits at age 65. Those born from 1938 to 1942 can receive full benefits somewhere between 65 and 66, depending on the exact year of birth. Workers born from 1943 to 1954 are eligible for full benefits at age 66, and those born between 1955 and 1960 are eligible between the ages of 66 and 67. Workers born after 1960 must be 67 years old. People who delay retirement beyond their normal retirement age receive a special increase in their benefits when they do retire. The exact amount of your benefit will depend on your earnings history. You should receive an estimate of this benefit, your Social Security statement, in the year you reach age 25, and then when you reach age 60 or older and not receiving Social Security benefits. Please refer to the handout to find out how you can request and review your statement online at any time. The current issues surrounding Social Security are retiring baby boomer generation. There's been an influx of retirees due to the baby boomer generation now all reaching their retirement age relatively around the same time as one another. People are living longer. People are living longer, meaning they anticipate to collect Social Security payments, monies, longer than initially anticipated when the Social Security program had been formed. Fewer workers paying into the system. Not every worker is contributing to the overall Social Security pot, which may exhaust the overall fund. By 2033, Social Security may not be able to meet all of its obligations because the trust fund reserves will be exhausted, according to the latest trustees. Because of the size and controversial nature of Social Security, there's no shortage of proposals for fixing the system. Among the options being discussed, raising the retirement age to 70, cutting benefits for wealthier seniors, trimming cost of living adjustments, investing the Social Security trust funds in the stock market, diverting a portion of payroll taxes from retiree benefits to private accounts. The proposals that call for either investing the Social Security trust funds in the stock market or allowing people to invest some or all of their contributions in the various securities markets have generated the most controversy. Proponents say that investing Social Security assets in the stock market would greatly enhance the program's returns, thereby increasing its reserves and longevity. Despite the market crisis of 2008-2009, stocks historically have performed better than any other type of investment, although past performance can't guarantee future results. Others say that the inherent market risk would rob some retirees of the very security that Social Security was created to provide. In recent years, there's been a lot of discussion in the media and on Capitol Hill about investing at least some of the funds in the stock market, although no decisions have been made. Expect to hear a lot about these proposals in the months and years to come. Now let's move on to the other major retiree program, Medicare. Medicare is a federal government program that helps older and some disabled Americans obtain and pay for medical care. Administered by the U.S. Department of Health and Human Services, Medicare is the nation's largest health insurance program, which covered 49.4 million Americans in 2012. The program is divided into two components, Part A and Part B. Part A is called hospital insurance and covers most of the costs of a stay in the hospital, as well as some follow-up costs after time in the hospital. Part A pays some other outpatient medical services, including some home health care. It covers none of the cost of prescription drugs. Under most circumstances, you do not have to pay a premium for Part A. Part B is medical insurance. This optional coverage is intended to help pay doctor's bills for treatments in or out of the hospital. It also covers many other medical expenses you incur when you're not in the hospital, such as the cost of necessary medical equipment and tests. If you elect Part B, a monthly premium is automatically deducted from your Social Security check. For more information about Medicare Part A and Part B, see the handout. You have two options for Medicare coverage: the original Medicare plan and Medicare Advantage, a managed care plan. Each of these programs has pros and cons. With the original Medicare plan, you pay your Part B monthly premium and then pay for additional services as you use them. In 2014, the standard monthly premium is $104.90. Additionally, the Medicare Part B deductible will be $147 in 2014. If your modified adjusted gross income, as reported on your IRS tax return from 2 years ago, the most recent tax return information provided to Social Security by the IRS, is above a certain amount, you may pay more. Medicare Advantage, an optional program available through private insurance companies, provides HMO-type coverage. Enacted as part of the 2003 Medicare Act, Medicare Advantage is expected ultimately to increase payment to plan providers and enhance the range of benefits available. To determine which program's right for your needs, call 1-800-MEDICARE 633-4227 or log on to www.medicare.gov. What's new for Medicare recipients in 2015? Medicare pays for many preventive services that can detect health problems early when they're easier to treat. Ask your healthcare provider what services you need. More help with prescription drug coverage. If you reach the coverage gap, donut hole, in your Medicare prescription drug coverage, Part D, you'll pay only 47.5% for covered brand name drugs and 72% for generic drugs. Among recent enhancements to the system was the creation of tax-free health savings accounts for anyone under age 65 who's enrolled in a high-deductible medical plan, defined as one with a deductible of at least $1,250 for individuals and $2,500 for families. These amounts are indexed for inflation. Maximum contributions to an HSA in 2014 are $3,300 for individuals and $6,550 for families. There's a $1,000 catch-up contribution for individuals between the ages of 55 and 64. Much like an IRA, the health savings accounts allow account holders to select a variety of investments to suit their time horizon and risk tolerance. Also, the account balance can be maintained from one year to the next. Distributions for qualified medical costs are tax-free, but non-qualified withdrawals are taxed as income and may be subject to a 10% penalty. If you choose the original Medicare plan, you might also be interested in securing Medicare Supplemental Insurance, or Medigap insurance. The term Medigap comes from the notion that these insurance policies will cover the gaps in Medicare payments. Medigap doesn't fill in all the gaps, but it helps. Before you buy a Medigap insurance policy, consider not only the services covered, but also the amount of benefits and the monthly cost of the policy. Also, pay attention to how much premiums may rise in years to come. You might also want to compare Medigap with Medicare Advantage. For more information on Medigap insurance, call 1-800-MEDICARE 633-4227. Up to this point, we've spent most of our time learning why you shouldn't rely on Social Security and Medicare to cover your needs during retirement. With that firmly established, let's now talk about what you can do to help ensure a comfortable retirement. Fortunately, you have more choices than previous generations, which we'll discuss in a moment. With these choices, however, comes responsibility. It's up to you to determine whether you should contribute to a retirement plan, how much to save, and what investment options to choose. Regardless of your age, investing for retirement should be among your top financial priorities. However, one of the greatest challenges for most people is realizing the need for a retirement investing program. According to financial experts, you'll need 70% or more of your final working year's salary each year during retirement. Since Social Security was never meant to be the sole means of support in retirement, you have other options for retirement savings. Fortunately, there are several tax-advantaged investment options for retirement savings, such as 401k plans and IRAs. There are two types of 401ks, traditional and Roth plans. Traditional plans offer several tax benefits. Since contributions are taken out of your paycheck before income taxes are assessed, you pay taxes on a lower amount now. What's more, earnings on your traditional 401k account can potentially grow and compound without losing some of that growth to taxes each year. Roth plans feature after-tax contributions, but qualified distributions are tax-free. Roth 401ks are available at the discretion of your employer. Ask your benefits administrator if your company offers this retirement savings option. In addition, many employers match a portion of your contributions, which may potentially be the easiest money you'll ever receive. Think about it. If your employer matches a portion of your 401k contributions at a rate of 50 cents on the dollar, that's an automatic 50% return on part of your money before it's even invested. If your employer offers a 401k or similar plan, take advantage of it. Also, try to contribute the maximum. Remember that early withdrawals prior to age 59 and a half may be subject to an additional 10% penalty tax. Another important way to save for retirement is through a traditional IRA or a Roth IRA. These accounts offer significant tax benefits. With a traditional IRA, your investment is potentially tax deductible depending on your income level and participation in an employer-sponsored retirement plan. And like traditional 401k plans, earnings can grow and compound tax deferred. A Roth IRA doesn't allow for deductible contributions. However, any earnings grow tax deferred. The big payoff may come in retirement, when you can tap those earnings without paying federal income taxes, provided you're age 59 and a half and have held the account for 5 years. Like 401k plans, most early withdrawals from IRAs are subject to a penalty tax. Because of the complexities involved with these retirement savings vehicles, you might want to consider using the services of a qualified financial advisor to help you with your investment decisions. Today, we've covered the current state of Social Security and Medicare, perhaps the two most important issues to every future and current retiree. We also reviewed the importance of planning for retirement and taking advantage of the investment options available to ensure a comfortable retirement. The next step is yours. Perhaps you'll need to make an appointment with a financial professional to sort out the wide range of choices available to you. You may also want to contact the Social Security Administration to obtain your estimated benefit. Consult your handouts for information on how to do that. Whatever your situation, keep the following in mind. Don't expect Social Security and Medicare to cover all your retirement costs. Stay up to date with Social Security and Medicare benefits. Plan wisely. One last point to consider. You could spend more than a third of your lifetime in retirement. Planning for your retirement so you don't have to rely solely on the uncertain futures of Social Security and Medicare is time well spent. Thank you for attending this session.